Today, you will learn how to pack your very own emergency medical pack, what you need, how to organize, and when to take it. Welcome to EM Pulse, bringing research and expert opinion to the bedside.
We're your hosts, Sarah Medeiros
and Julia Magaña.
Welcome back to EM Pulse.
It is summer again, which is exciting because it means the kids are out of school and we are unleashed to travel again. You know, Sarah, our boys are good friends and they are both prone to get themselves into a scrape or two when traveling. I know that that's true for my son.
Yeah, I think it's pretty inevitable that when you're traveling with young kids in particular, someone is going to get sick or hurt. And, I struggle with what to bring with me.
You know, Sarah, I do too, which is why I am excited on a personal level to pick the brain of our UC Davis wilderness medicine expert and professor of emergency medicine, Dr. Mary Bing.
Welcome, Mary.
Why, thank you.
Mary, how did you get started in wilderness medicine and be interested in the topic of traveling as a physician and a parent?
So my husband and I met at camp, and he was the outdoor camp director, and that's how I kind of got started.
Yeah.
So I was very lucky that my mentors at Cornell, when I was in residency, were co-founders of the Cornell Wilderness Emergency Medicine.
Cool. Okay, so, I just talked about my kids, obviously, scraping themselves and getting sick and all these things. But when might a physician actually want to bring medical supplies with them on a trip?
I want to start with a framework that it's my opinion and my outlook is if you were going to go on a day hike, what would you bring with you?
Okay,
limit it to that and start thinking that way that when you go on a day hike, in your backpack, what equipment would you have in there? And then what medications might you bring with you?
Okay, so we're thinking about even just on a day hike, there's a possibility that you want to have supplies with you that are medical supplies. How do you decide which ones you want to bring with you?
So, first of all, on a day hike versus a backpacking trip, you're actually more likely to need your kit because you're not as prepared. And mentally, you're like, it's short. I don't need to bring a lot of stuff. And that's when injuries are more likely to happen. With that, then I start thinking about who's on the trip. Is it me? Is it my kids? Is it a group of students I'm going with? Is it coworkers? And where are we going? How high are we going? What's the climate like? Also, how far out are we from our car, from help? Do we have cell reception? Who has their GPS with them? And then a satellite beacon that can call for help. That starts informing what I bring with me. So then let's do when most of us go on a day hike. Let's say you go to the UC Davis Arboretum right now, right?
Yep.
Are you going to take your backpack with you, knowing that you have a lot of help along the way, right? It's not remote. You can whip out your cell phone, call 911 and get help. But that could inform what you take with you still, right? Another thing is like if you are just going to your kid's soccer game as a spectator or as a coach, how would you approach it differently? Versus if I'm going to my in-laws' house and they have dogs and my kids are allergic to dogs, what would I bring that kid with me even though I'm going to someone's house, right? Versus I am going to go hiking in Desolation Wilderness or backpacking in Desolation Wilderness and how far from the car. That all informs what I bring with me.
Sure, that makes a lot of sense. So like, where are we going? What resources do I have immediately available just by the location of it? And who is coming with me?
Right. And I break it down to a 5-step approach. First is, in my first aid kit, the W's and the H's of the trip, which I will bring up. And then the step 2 is I gather my first aid equipment. Step 3 is I gather my first aid medication. Step 4 is every item I take with me, does it have more than one use? If it has more than one use, right, great. I want you to look at your kit and see if I can come up with multiple uses for it. But if it's just one use, right, is it for comfort or a necessity? And think about that, right? And then step 5 for me is I go on my trip and I come home, I look at my kit, And I said, is there any changes I need to make for my next trip?
So I can already tell that you are way more prepared than me, and I have a lot to learn. Okay, let's start at the beginning. What are your W's and H's?
Okay, so the first W is who is going with me? What are the ages of the people traveling with me? What is the size of the group that are the people traveling with me? And do they have medical healthcare expertise or not? Then I am going to try to think how much help I'm going to have to provide or willing to provide.
Yeah.
And in terms of the ages, right, do I need to carry chewable medications, liquid medications, and are any of the medication, can they be modified to be per rectum?
Woo, now we're really getting out there in the...
And this just came up on MRAP this week. Okay, so the next W I approach is the what, right? For this group, or is it myself, what medical problems do they have and what allergies do they have? And for me, most of the time, this kit starts with my family and their medical conditions inform what I bring. So the next W is when. Like the time of year of the trip. What's the climate? Are we at hyper or hyperthermia risk? Are sunscreen needed? Right? Where are we going? Is it international or domestic? What are the vaccines considerations we need to have? And then do you need to show a card depending on the place you're traveling to for immunization record, right? Should I bring DEET? Do I need to bring my own syringes and needles? Is it urban? Is it remote? For medications I need to buy internationally, we know we can buy a lot of medications upon arrival, especially antibiotics, right? The next is, what is the altitude of that place? Should I consider acetylsolaamide? Should I consider dexamethasone, nifedipine, Viagra, right? Are you scuba diving when you get there? All the things you should consider is what kind of conditions you're going to be in. And that's with a W for where of what I bring for my kit. Okay. Next is the why of your trip. Is this solo? Is it with my family? Is it for a wellness medicine course? Because I did run a wellness medicine course elective for our senior medical students at UC Davis for about a decade. Now, is this for event medicine or are you an expedition leader, right? And what you carry probably depends on your role in this group. And then next is the how. How are you getting there? What's the length of the trip? What's the access to care? Once you get there, do you bring antibiotics? Are there dangerous activities? So if I'm going on a 5-day backpacking trip, probably by the time the GI bug hits, I'm out of the woods, right? So there's no reason to carry antibiotics for me. And if I get there, does it require a plane and a boat? And then the travel bus and internationally especially is going to be resource limited medicine that you need to consider.
That makes a lot of sense. I love your kind of systematic approach to it. Can we just kind of look at it for your own bag? Okay, Mary, so you're going camping with your family. What do you take in your bag when you're going to go out in let's just say a backpacking trip for a few days with your family? What do you take?
So that brings me step 2. What do I bring in my own bag? And I think the best way to start this is probably on a day hike. Okay. What do I bring with me? And on a day hike versus a backpacking trip, I will be a lot more prepared for my backpacking trip than my day hike, less likely to get myself in trouble. So on a day hike, what would I have first is on my kids, everyone has a whistle around their neck or in their pocket, on their person accessible. And the whistle, what for my personal use, we have used it for is my kids have gotten lost in a store internationally, grocery shopping, and they couldn't find me, so they whistled for me, and I came to look for them.
Fantastic.
Yes, and once when my younger boy was 3 years old, and we were in Switzerland, and I left him on the train platform, and the rest of us were in the train, and he whistled, and that's how I know to go back down and get him. So it comes in useful, and I joke, but there's some truth to this. I've seen many people break down in IKEA because they don't know how to get out of the marketplace. And whistle will come in really useful there.
The wilderness of IKEA.
I like to joke, but it's true. Titanic. Kate Winslet's character got saved because she blew her whistle.
She did. This is true.
Right? So whistle around everyone and teach your kids how to use it. And it's important even as adults, we should have it. The other thing that's very useful is a compactor trash bag. You want it to be thick considered to be orange because it's easier to spot when you're looking down from above as people are searching for you. And what it's good for is it's an extra rain layer. It's a shelter you can climb into, especially if you get the big ones. It's a backpack cover. When you're backpacking, you don't have to buy the extra fancy ones, right? It's an extra warmth when you need it around your sleeping bag. You could use it for a hypothermia wrap. And you could slide victims in snow across the snow very easily if you need to get them to safety or tuck them away so that they're not exposed. And you can use to get water to cool victims down if they're hyperthermic, right? And just kind of could drag them across dirt to get to help. There's a way to wear it appropriately and how you wear it, because you don't want your head exposed. Think about how you do the cutout so your face can be facing out, but the rest of you is covered. The way I also like to use it so that it's multi-use is I put it inside the backpack. I put all the things I want to keep dry inside the bag, and I put my water bladder on the outside in case I have a water bladder leak.
That's smart, yeah.
Another equipment I take with me is duct tape. There is a saying out there that if you can't fix it with duct tape, you did not use enough duct tape. And what I personally used it for is to remove splinters, remove cactus thorn from my kids' hands because they're like, Mom, look, this is a needleless cactus. It's not.
Yeah.
Duct tape just on multi-uses. You can use them also to be a steri strip, to fix a broken tent, a hole in your puffy jacket. So many uses, right? What flight nurses do is they take the duct tape, they put it on their thigh so you can write it with a Sharpie to take notes in an emergency, right? So it's multi-use that way. You can see if you are lost or you're trying to communicate, you could put notes along the hiking trail to another party or to signal for help.
Yeah, that's smart.
Someone always carries a Sharpie because a Sharpie is permanent marker and lets you write notes. It lets you take notes, especially as a health care provider, that if you render help to anyone, you want to take some notes. And the phone might not always be available. Another thing, my equipment is Velcro straps because that can be used to strap extra stuff onto your backpack. I use it to carry my skis instead of the bulky ski strap carriers. I just use one tiny little Velcro strap and it keeps it together so much easier to carry. And you can imagine you can use that to wrap dressing around your soft tissue, around your limbs. You can use it to wrap around a SAM splint, and we'll talk about SAM splints. Carabiners are always useful to clip things in, water bottles, extra gear you need. Another thing that carries freezer Ziploc bags. Freezer because they're a little bit more waterproof and they can double as gloves when you don't want to touch blood, especially if you're trying to apply direct pressure to stop bleeding. And it keeps your stuff waterproof if you were to go into a body of water. And when you have kids, they always want extra snacks. And you can put your leftovers in there.
Fantastic.
And less waste. Another first aid equipment I take with me is panty liners.
Oh, interesting.
Panty liners. This might be a little gross for some people to hear, but it is multi-use for me because sometimes it's just really hard to stay clean when you're backpacking. And what you can do is have panty liners and you can change that out and make sure you put in a Ziploc bag and pack it back out. In there, the cotton, you can take the cotton out and actually put some Vaseline on it and use it as tinder. And it is a dressing. It's a Band-Aid. You can wrap around and use it for any abrasions, bleeding wounds. You can use it to try to stop bleeding too.
Yeah, I've heard some people actually talk about tampons too, using like non-applicator tampons for nosebleeds and things like that. And it's another way to carry cotton.
Exactly.
Multi-use. There you go.
The next thing is if you're on a day hike, I usually bring a knife with me, but the knife is not something I usually keep in with my first aid kit just because I travel internationally. I don't want to get confiscated all the time, so I have to be mindful of that one. Couple more items in the first aid equipment is a SAM splint.
Okay.
A SAM splint has multiple uses in terms of you can splinter limbs to make it more comfortable. You can use it as a beer cozy to keep it cold, to keep your hot chocolate warm. And then if you need to, as a common measure, fold into a circle on a wet ground and sit on it, right? And so you sit there and don't move, especially if you get lost. Our mentality is we get anxious, we move around, and we get in more lost, right? What I do is I fold the Sam's plant into a triangle, and I would pick a spot that's not wet, but even the ground spot, I sit on top of it. I have my compactor trash bag over me, and you sit there until you're rescued and blow your whistle. So the mentality is really important. And I want to refer you to a resource. It's called Surviving a Wilderness Emergency, Practical Advice on What to Do When You Find Yourself in Trouble in the Backcountry by Peter Kummerfeld.
Okay, cool. We'll put that in the show notes.
And one more thing to take with you is safety pins. Safety pins, I've used it as a screwdriver for my husband's glasses. He's blind without his glasses. You can take splinters out once you properly sterilize it. Also, you could repair clothing. You could repair tents. Another thing is very easily you can fashion a sling by folding your shirt over and using a safety pin to put it in place.
Fantastic. That's a great list of stuff. And I'm already online ordering some new supplies for my kit. What about medications?
So medications, right? Mentality I approach this with is what are medications that can save lives in the range of minutes? And what two medications I can think of are EpiPen and Narcan. Narcan is a relative new addition to my kit, as you know, from the opiate crisis. The EpiPen I've been carrying forever. First of all, is because my older child has a lot of allergies, has asthma. And besides saving your life anaphylaxis, if you have a severe asthma attack, we know the second you can use Epi for bronchodilation. The other thing is, in a remote setting, EpiPens, there are ways you can look online to find a multi-dose use out of it in a resource-limited environment. You don't have a second one. You can take about 4 or 5 doses out of there. And the other thing I carry all the time is Vaseline. Whether you consider it a medication or not, it has a lot of implications for wound care. Can have chapped lips. You can put it around cotton balls, and actually it's a really good tinder when you're starting a fire. Especially if you're day hiking, you're caught in a storm, you just need to hunker down. The meds that I carry, it's going to be very individualized, right? One thing I start with is alcohol swabs. Alcohol swab is multi-use, but for me, as I got older, I'm getting a lot of motion sickness, and it has helped me finish a lot of roller coaster rides. I smell it as I ride it. And then the medications I carry are dexamethasone. Again, it has multi-use implications with my child with asthma, for severe sore throat, for altitude, if you need to ride, for a very severe case of contact dermatitis. It's multi-use. Zofran, just because it can ruin a trip if you're nauseous and vomiting. Pseudoephedrine I carry for flying purposes or going up in altitude, just for that's comfort. Haven't found a secondary use for except decongestion. Ibuprofen and Tylenol, why carry 2 things? Because we know it's a little more effective sometimes when you combine both at the same time for pain control. I carry Benadryl diphenhydramine because it's multi-use. You can use it after an allergic reaction. You can use it for sleep. And interesting enough, it's a sodium channel blocker. So if you have dental pain, you can imagine chewing it up and making a slurry and just kind of putting it on that area of pain. It will numb that area a little bit. It's similar to how toxicologists said that for kids with a lot of sore throat, sometimes you could use liquid Benadryl.
Interesting.
And I actually tried it, and people have instantly told me that they used to chew their Benadryl, and they get a little numbing on their tongue, right? And so Benadryl has a numbing effect. So a secondary use is if you have kind of sore throat, you can hold in the back of your throat after you chew it up, or you could put it on the area of gum pain, dental pain, canker sores, see if that helps too. And another thing I've been meaning to try is Tessalon pearls. Probably has the same effect, but I just don't carry it because it's liquid and it's prescription. I don't tend to carry prescriptions and stuff except for ondansetron. Loratadine, so a non-sedating version of it for all the allergies. Everybody has allergies in my family. Pepsid, why Pepsid? Because of Asian drinking disease. I guess, so that one is just a one-time use. That's just purely for comfort. And I started carrying loperamide and Imodium because of it can end at travel. And if you have long bus rides, long boat rides, it's nice to have.
Yeah, for sure.
Right. Some people that travel sometimes consider Pepto-Bismol for traveler's diarrhea prevention, but there's subsalicylate in there, so I'll be careful with that. That's my medication. So it starts with what saves lives in minutes, and next is what's comfort, convenience, necessity, and are they multi-use?
Mary, if you are a physician and you want to take some of these prescription meds like an EpiPen or ondansetron, and maybe you don't have an indication in your immediate family, is there a way to get these meds to take with you?
I understand UC Davis has a travel clinic that you can get medications prescribed for you to take with you. And I also work on express care where patients have asked, I'm about to go on this trip. Can you prescribe this for me? And I said, sure, why not?
So you have to find another physician to prescribe it for you for travel purposes.
Correct.
Even as a physician is your way to do that.
Correct.
Yeah, that's tricky for sure. And I always wondered, I mean, like, you used to be able to just like pull out a prescription pad and write it for your child or for yourself and nobody questioned it. But
well, and I think about epinephrine and how expensive EpiPens can be. No one in my family has an indication.
Right.
How much would it cost me to buy an EpiPen? I mean, it's probably worth it, whatever it is, but I haven't done that yet.
Yeah. Now, I think if you're going for a larger group, for somebody that, you may have that indication within there, that's an interesting question or thought on that. What about the dexamethasone? Do you do the same thing for that? Ask for that at the travel clinic or?
I believe you can
Telehealth?
ask for it, telehealth, but one of my sons has asthma, so we have dexamethasone lying around.
Yeah.
So we've gone through the step 1, the W's and H's of the trip. Step 2, we've gathered first aid equipment. Step 3, we've gathered first aid medications, right? Step 4, every item, does it have more than one use? And if it doesn't have more than one use, is it for comfort or is it necessity?
Okay, so that brings us to step 5.
Step 5, right? What I do is I go on the trip and then I look at what I've used and I come home and I reassess my kit for the next trip. And I not only just what I bring, but how I package it is very important for me.
Yeah. Tell us, do you have a strategy for organizing all of your gear? Any favorite systems or bags or tips to make your kit more efficient?
Yes, I have this small organization bag that has multiple zippered compartments where I can stash a headlamp in, the knife in. The next is my wound care stuff, including my Ziploc bags, my panty liner, Vaseline. I have Vaseline everywhere. And then the next compartment, I would put in extra batteries and a little bit of cash. And then another compartment, I would store my EpiPen, my Narcan, and my pill box. And my pill box has 2 compartments. One at the top where it's bigger, I can put the alcohol swabs and the safety pin in and my panty liners in as extra if I just take that with me. And then the second layer has, like any other pill box, has a lot of little compartments within it. And in there, I put individual medications and I label it clearly. Because most of us in the past tend to take it and throw it in a little Ziploc bag, tiny Ziploc bag, and write on it, right? And I find that cumbersome to dig through. Or if you put all of your pills in one, you're trying to remember which is which. It's a little harder. The way I've organized it and actually printed out what they are has helped me quite a bit. And if there's similar, I'll put in the same compartment and just take that with me. And a lot of times, this small organization bag, I take it with me when I go backpacking, when I go day hiking, when I go to my in-laws' place, when I go to a soccer event, to watch a game. It just goes with me because most of what I need is in there.
So how do you modify your bag if you're going on like an international trip or to an austere location or something like that? What kind of modifications do you make?
So on an international trip, you have to be careful how you carry your medications. First of all, you should check online to see each country's laws of how many days you can carry with you and if they need to be in their original packaging. And are you allowed to carry scheduled medications with you? Or do you need an actual doctor's note to say what you can carry with you? And I don't tend to carry 30 days worth because we only go on 2-week trips. And this is the same bag I carry with me. Most places I travel to haven't required me to carry it in their original bottles. So go on an online resource to check for each particular country's regulations. For international travel, a lot of times it's infectious disease, it's mosquito risk.
Sure.
So consider taking DEET with you, but we are limited by the liquid size.
Yeah, that makes sense. All right, Mary. So it's obvious if it's your family, they're going to consent. What about people outside of your family? What is my obligation and how does the Good Samaritan law apply? And let's just stick with the United States since that's the easiest and each country is different.
Okay, with the United States, for the most part, including DC, Good Samaritan law can protect you from civil lawsuit. There's a few states that might not, and you should look it up for your individual state, right? So the legal protection under the Good Samaritan law in the United States are if you act in good faith, if you provide reasonable assistance, you do not expect to receive compensation for the help, and you do not act with gross negligence or willful misconduct, then you're protected under the Good Samaritan law. Lawsuit, they can still sue, and it's more likely to be successful if the aid caused harm, if the person acted with gross negligence, and the assistance was not considered reasonable under the circumstances, and that the person providing assistance had a duty to care for the victim, then it's not protected under Good Samaritan.
Okay. But most of it is, if we use those principles, and it sounds like we should feel fairly reassured that doing the right thing, doing the best that we can with inside of the scope of our practice and not getting reimbursed will be a safe line of approach to these cases. Is that fair?
Fair. And when you approach a victim first, ask if they want you to help or not. If they're unconscious, you could presume they want your help.
Fantastic. Mary, do you carry any documentation or emergency forms with you?
I do not. Funny enough, though, I was asked to help in an in-flight emergency. And just because of credentially, I happened to have my medical license on my phone and they wanted to see it and I pulled it up and that was all. But not everyone asks.
All right, Mary, anything that we haven't covered here?
I think your first aid kit is going to be still individualized, right? The framework is everything you take should be for a good reason and just be thoughtful about your approach when you take it with you and start playing with it. Think about what other uses I can have for it.
I like it. Well, this has been a very practical discussion. I am going online right now to buy Vaseline packets, orange compactor trash bags, whistles, and safety pins for my own day trip pack.
This is inspiring me to be much more prepared than I usually am because I can see how this could really come in handy. So thank you to our department for having experts we can all learn from, like Dr. Mary Bing.
And thank you to OM Productions. Has Mike will travel.
So until next time, stay curious, stay inspired, and stay tuned.
The opinions shared on EM Pulse are those of our hosts and guests. They don't necessarily reflect the views of UC Davis Emergency Medicine, UC Davis Health, or any of their parent organizations.